work would not be possible without the support of the planning committee members, which includes stakeholders such as people with lived experience, law enforcement, providers, advocacy groups, and more from around the state. It also wouldn't be possible without our state legislators. Both Sataniel and Kay have been an instrumental part of the planning. Chairman Sam Mims and Representative Kevin Felsher, they both have supported by introducing legislation this year, and which actually passed both the House and Senate and is now on its way to the governor as of yesterday afternoon. So we are thrilled that we can report that today. Along with Chairman Briggs Hobson and Chairman John Polk, who have supported funding 988 implementation and the continuation in the ARPA legislation for mental health. You know, enhancing the crisis system and implementing 988, we truly believe is going to help bring hope to hundreds of thousands of Mississippians and people across the nation, because this is a national initiative. But it's also going to help further the mission here in Mississippi for people to be served in their local communities. Our overall goal is matching what SAMHSA's national guidelines for behavioral health crisis care encourages, and that is that a state has all three components. That you have someone to talk to, which would be the crisis lines in 988. That you have someone to respond, which would be mobile crisis response teams, and then somewhere to go. And that could be a range of crisis stabilization units, diversion centers, which we have plans to expand over the next several years, and then an outpatient therapy appointment possibly. You know, while the inpatient part of the continuum of care that's provided by state hospitals needs to be maintained for those who need it, our priority is to do everything that we can to divert from that level of care and provide those services in the community. We had an ARPA proposal to the Mississippi legislature this year, which I'm sure several of you have already heard about, and it focuses on initiatives that enhance the state's crisis system for behavioral health, but also for people who have intellectual and developmental disabilities. And the services in the proposal intend to reduce admissions to the state hospitals. It includes the addition of 60 crisis stabilization beds. It includes crisis diversion homes, specifically for people who have intellectual and developmental disabilities. We have enhanced training to serve Mississippians who are dually diagnosed with a mental illness and an IDD. The funding also includes adding court and law enforcement liaisons to help connect people to community services to decrease that need for that higher level of care. And then also a lot of evidence-based training is included, especially around law enforcement with crisis intervention training and mental health first aid for public safety. We also have something that's exciting and will be new to our state, which is to fund 3 peer support respite programs. This is something that we do not currently have in Mississippi. These are voluntary short-term day programs that provide community-based crisis support to help people find new understanding and ways to move forward. The evidence is firmly behind the impact that peer support can make in someone's recovery journey, and we want to be able to expand that and offer it through respite programs. We also want to focus on the evidence-based and best practices that have been proven to be effective, and that there are clear outcomes to show that these services are making a difference in our state. I'll give you one example. 10 years ago, Mississippi did not have intensive community services such as PAC teams or what we call I-Court teams, intensive community outreach and recovery teams. We now have these services, our intensive community support services, which we call ICSS, in all 82 counties. So in just the first half of FY22, which is the fiscal year we're currently in just the first half, there were 1,098 Mississippians who received PACT or I-Court services. And these are for people who are at a high risk for hospitalization. Out of that 1,098 people who received the services, 30 had to be readmitted to a state hospital. There were another 730 people who received intensive community support services, and 40 of those had to be readmitted to a state hospital. This data is showing outcomes that it does decrease a person's need for hospitalization, which is exactly what we want to see. 10 years ago, we had around 500, 510 acute psych beds in the state, and we served over 3,500 people in those beds. And then this past year, we had 288 psych beds in the state and served 1,774 people. That's a decrease of about 52% in the number of people who are needing inpatient psychiatric care. And this is the trend that we want to see continue and get even better. We know that feedback and partnerships are the key to all of the accomplishments that have happened so far and all those that will come forward. But many of you may have participated earlier this year in some feedback sessions with the National Research Institute. And we did that to try to help guide our strategic planning process, particularly in the area of adult mental health services. We are working on some other ways to expand avenues for feedback, and we appreciate all of your participation in that as we move forward. Again, it takes those partnerships, and there are so many that have occurred over the last year. And I'd like to take just a few minutes to highlight a few of those because I know many of these people are on the call today too. Just last week, we partnered with the Mississippi Public Health Institute and Hines Behavioral Health Services and 3 amazing churches in the local Jackson area to launch our state's first congregational recovery outreach program. We know that faith and community leaders are often that first point of contact for families when they have a crisis or a traumatic event. And we know that people turn to their faith leaders many times before they're going to turn to a mental health professional. We know that African American communities, the role of the faith community is even more impactful. So that's why we want to have a focus on providing training and support to our faith leaders. I encourage you to stay connected with DMH through Facebook or Instagram, and you'll be able to learn more about this program as it expands. A second partnership over the last year that's been exciting for our state is that Mississippi was selected as one of 8 states to be a part of the Governor's Challenge to prevent suicide among service members, veterans, and their families. This initiative is a partnership with SAMHSA and the United States Department of Veterans Affairs, and it is to implement statewide suicide prevention best practices. So Mississippi's team has been working over the last year for 3 priority areas, and that is to identify service members, veterans, and their families, and screen for suicide risk, to promote connectedness and care transitions, and then to enhance lethal means safety and safety planning. We've also formed some amazing partnerships over the last year with the creation of the Mississippi State Hospital's Psychiatry Residency Program. One of the primary benefits of the training program is to increase the number of psychiatrists practicing in Mississippi. We have right around 170 practicing psychiatrists in Mississippi, and data shows that we need close to 350 to 400 in the state. This year, more than 400 people applied to be a part of the program, and it's going to add another 6 residents in July. This alone is going to help with additional workforce with the state hospitals, but also with the community mental health centers, crisis stabilization units, and other local hospitals. So this is a very exciting program for the state of Mississippi to have. There's also been a lot of focus on early intervention with children and youth. The state's added 2 more Navigate teams for adolescents and young adults who are experiencing that first episode of psychosis, and also looking at intensive community supports for children and youth. There's so much work that's being done across the state by staff, community providers, advocates, families, and in partnerships with so many different agencies and organizations. That's just a very brief snapshot of some of the activities happening. Lastly, I wanted to give everybody an update also on the state's work with the court-appointed monitor for adult mental health services. Recently, just this week, the monitor, Dr. Hogan's first report was published, and it's available on the internet. It's going to be on our website too soon. And so I encourage you all to read his report. We have appreciated getting to work with Dr. Hogan and his visits to the state over the past several months. And we are glad that his report acknowledges progress that the state's mental health system in a variety of different areas, especially with enhancements in discharge planning and warm handoffs as people are transitioning to a different level of care. But we also know there's work to be done, and we have plans to try to continue enhancing that process over the next year. We appreciate that he acknowledged the effectiveness of intensive community support services like PACT and ICORT, as this does impact the readmissions to the state hospitals. He also acknowledges staffing challenges that have been related to the pandemic. And those are not just at the Department of Mental Health programs, those are staffing challenges that's across the state with community providers, local hospitals, everyone trying to provide services and supports. And he acknowledged the stress that the pandemic has caused, both on staff and everyone in the state. You know, it is our hope that our programs and all community providers are able to return to pre-COVID staffing levels, so where we can all continue to help Mississippians access care in a timely manner in their local communities and in the least restrictive environment possible. We are also moving forward with fidelity reviews for the services that are listed in the order. And those are to make sure that they're operating and having the outcomes that are intended. There's some more initiatives that are going to be underway to assist with crisis services such as 988 and some of the things that I mentioned that's in our ARPA proposal. And we're also looking at other states to provide some training and some technical assistance to look at some experts and some models that we can replicate. So we are committed, as I know all of you are on this call, to making improvements in the system and to bettering the state. You know, this past year has been very difficult and things are getting better, but we don't know when they're going to get back to what we would have called normal 2 years ago. But it's important that we focus on our health, and it's important that we remember that our health includes our mental health, and it's important that we get help when we need it, and most importantly, that we encourage others to do the same. So I look forward to working with you, with our families, our community partners, our state leaders, to develop and support innovative initiatives that will open doors for the health of our state, but most importantly, that will bring hope to our state, which is something that we all need each and every day. So I want to thank you again for the opportunity to speak with you today, and we've got some more amazing presenters on the agenda. So thank you again.
Thank you so much, Wendy, for being a part of today's events. We're really excited about the passage of 988 and the expansion of crisis services in our state. So thank you for your time this morning. My name is Molly Taylor, and I work with the Mississippi Department of Mental Health, and I'm really excited to introduce you to our next speaker, who is going to share some information about crisis intervention teams. Christiane Williams has been in law enforcement and corrections for 25 years. She currently works as a field agent with the Mississippi Department of Corrections. She's a certified law enforcement officer with an educational background in criminal justice and has extensive training in all aspects of law enforcement and corrections. She is active in the behavioral health community and is a certified mental health first aid instructor for public safety, adults, and youth. She's a certified instructor for the Mississippi Board of Standards and Training for Law Enforcement, a crisis intervention team trainer, and a trauma-informed care instructor. She is involved in various community organizations such as the National Alliance on Mental Illness and Hines Behavioral Health Services Crisis Intervention Task Force. Due to her involvement in the American Probation and Parole Association Training Institute, she was recently selected to become a part of a national best practice workshop in corrections. Christiane is the creator of Leading by Example, which is a 4-hour workshop that provides awareness about mental health and community resources. The workshop has been endorsed by the Mississippi Department of Mental Health, Disability Rights Mississippi, and Hines Behavioral Health Services. Christiane resides in Jackson, Mississippi, and is the mother of 1 son. So at this point, I will turn it over to Christiane.
Good morning. Again, thank you for that warm welcome, Wally. I appreciate it. I am grateful to have the opportunity to be able to elaborate this morning as a law enforcement officer, the importance of CIT. If there's any questions about any of the slides, you all feel free, email, call, send a message. I'll try to get you the answers that we need. But I'll go ahead and get started in the interest of time. The crisis intervention team, this is just the basic course that when we have officers that come in as an instructor, that we tell them on day one, what is CIT, what is the importance of it. It's just a basic course where law enforcement especially gets specialized training in serious mental health crisis. Just kind of giving you a background as a law enforcement officer, typically when we're dealing with persons going out on the scene, and that's what I was explaining when I started working with the mental health agencies, law enforcement actually doesn't know the difference between if someone is a mental health crisis, drugs, or a combination of both. So that's why I was trying to explain to the law enforcement officers, it's great to have this tool to put on your belt. You know, we can never get enough tools to put on our belt when we're dealing with persons within the community. The purpose, why is intervention team important? You know, it gives officers specialized training. You'll be able to respond to incidents with person with mental health ailments. If you got, you know, the psychological part of it, you know, it's an approach. You know, you're trying to prevent people with serious mental illness to being in jail that may have alcohol or drug problems or a combination co-occurrence problems for both of them. The primary goal is to develop an understanding of the officers. The officers need to get an understanding, you know, the fundamental rights of a person with mental illness. One of the things when I did my training, leading by example, I was elated for Disability Rights of Mississippi to be a part of it, because I wanted to make sure officers know, because you can't see it, it doesn't mean it's not a crisis, or doesn't mean it's not an illness, doesn't mean it's not a disability. Those are three things that I, as an instructor, you know, not went into a debate, but just actually had to break down with law enforcement officers just exactly what that means. And it's provide assistance to the subject that actually is in a crisis. The motivation for the training, law enforcement agencies across this nation, I think we've all seen it. We're being sued for deadly force against persons with mental illness. You know, law enforcement is frustrated because they don't really know what to do. And that's why I tell them all the time, the lack of knowledge, 9 out of 10 times will get you into a lawsuit. But if you have the knowledge and something happened drastic, you do have that training to say, I did A, B, C, D prior to doing this here, you know, before it escalated, especially if we have to use deadly force. You have utilized every tool on your belt before you utilize deadly force. So that's, you know, I believe in just being very transparent when I talk to them, being in training class, being in law enforcement, and been in situations. Thank God it never came to a deadly force situation, but it's part of the job that you have to deal with. The history of it, the lack of training, personnel regarding mental health. As a 26-year veteran, honestly, I don't remember any training when I went through the police academy, but things have changed. Now, minimum standards actually is giving them 12 hours of required mental health training in all of the state law enforcement academies. We are trying to get minimum standards to make a yearly requirement for all law enforcement to have mental health training annually, because we're going to need it. It's changing. The distrust and the polarization of law enforcement officers and mental health, it's been there. It's been a stigma. Director Bailey alluded to it, especially within the African-American community. There's a big distrust with just the mental health system altogether. The aspect of the problem, this was written in 2004, and sadly, we are still dealing with this. There is no question that law enforcement officers are increasingly the ones that respond to people with mental illness who are in a crisis. That's why if we saw this, somebody saw it in 2004, and we're now in 2022, and it is well over time for law enforcement to take a different approach on how we approach persons with mental illness in the community. the old traditional way. You know, when we was in the academy, you know, you get compliance by any means necessary. Those tactics are out of the window. You know, we can't do that anymore. You know, you're going to force physically force somebody to comply with you, and they may be in a psychotic state. Those are some of the things that we actually break down during the CIT training for law enforcement officers. The results is lawsuits versus liability, lack of trust, confidence in law enforcement, dissatisfaction in law enforcement, to uncertainty of how to handle these calls. That's the result of having persons with CIT training. It originated out of Memphis, Tennessee, a 26-year-old man. Everybody in the community known he was had a mental health issue. Law enforcement responded. It resulted in the officer actually having to discharge his firearm and shoot the subject. After that, the developers, retired Major Sam Cochran and Dr. DuPont of the University of Memphis teamed up. So that was law enforcement, mental health, and came up with the crisis intervention team in 1988 is where it was formed from. In Mississippi, we are on the 10-year anniversary of CIT being introduced to the state of Mississippi. It started out in Lauderdale County, and Meridian Police Department initiated the first interest in CIT 10 years ago. The retired Captain Wade Johnson is the face of CIT for the state of Mississippi. He has trained most of us, if not all, CIT instructors. At one point, everybody was going actually to Meridian, but now we have spread this wealth over the state, from Tupelo to the coast, to the Hinds County have theirs, Hattiesburg have theirs. So we are trying to make sure everybody, we are covered up on the CIT throughout the state of Mississippi. Why is the Memphis model? Is law enforcement based, mobile crisis component, interaction with law enforcement, mental health community, the consumers, and the community as a whole come together to form this CIT task force. It's just not the mental health. We bring in people from all over to be a part of this. Why is CIT important training? It's helpful to the officer to make sure that we're giving them every tool that they can, know their resources to get compliance when you're out there and a person approach you, or you approach that person, or you get that call from dispatch about a disgruntled person, acting erratic. You just don't know. You'll be able to give you more tools to actually use when you're out there in the street. CIT has been shown to be positive impact. Also perception, it decreased the high levels of interactions, it decreased officer injury, and it redirect the person out of the criminal justice system into the healthcare system. CIT officers respond to the incident. We're trying to get it where when the family call the dispatch, that they be able to dispatch out and say, you know, I got Christiane Williams, family called in about her. We need a CIT officer at 1234. That officer know, whoever that CIT officer in that area will respond to that call. That's our hope and our goal, that we have all officers in the state of Mississippi actually trained in CIT. So no matter who gets the call, that officer that responded out will be able to actually adequately handle that call. The CIT, and this is kind of what I kind of alluded to, you know, emotionally disturbed person can be involved with suicide or party armed. That a CIT officer would respond is what our goal is, to be the liaison between that person and getting them to the mental health facility that they need to be at. CIT officers are required to document each call or contact with a person. That is the data that we will have to have. It does help for funding, making sure. So if you all have CIT officers, like I explained to them, if they don't have a report and they have a contact with a person, you're a certified CIT officer, just email it to your community mental health center person, the coordinator for CIT. It will help in the end, because that'll be able to, when I'm saying we, because I be over at Hinds Behavior Health so much in the Department of Mental Health. So we'll have the data that we need in order to make sure we get the funding that's needed to continue this program throughout the state. the basic training, CIT training, is 40 hours that we ask the officers to come and sit down and put the guards down. And if you all have never been to a CIT class, the first day and the last day is a 360-degree turn. Most of them come in, they're tensed up. Half of them are voluntold to come, but by the time they leave there, their whole perception and attitude about a person with mental illness, it has changed. And, you know, I've been doing it for a while, and every class we have at least 1 or 2 people in that class that just break it down for the other officers. And these are all people that have never seen each other. Most of them come in, put them together in a group. And by the time, usually day 2.5, maybe 3, you're going to have that one person when we get to a subject that's just going to really just open up, and that's just going to be the ceiling that crack. You'll be able to see it. You'll see the change in their demeanor and attitude about it. I will share this. Dr. Tiffany Anderson did a icebreaker the other day, and it was just profounding how their attitudes changed within the first hour of the class. So it is, if you get an opportunity, observe one and look at day 1 and look at day 5, it makes a difference. This training instills confidence in the community and the consumer. A lot of consumers will see that CIT button that we give them or provide to them, and they automatically would trust that person because they know that this person understands me. This person has been trained by mental health. This person may have been trained by my counselor, you know, my therapist. I can trust this person. They really understand it. And it brings law enforcement and mental health together. It doesn't make us therapists by no means. I tell people all the time, we understand our professional boundaries, but we are not therapists. We can't do it. It is not error-free, but it's been proven to be very effective. And that's what we want, something effective. Anything that you do is not going to be error-free. CIT techniques and training does not supersede their policy, their agency policy. And that's one of the things we tell them, you know, you still up under the guidelines of your agency. We're just trying to give you more tools to make sure that you can use them. That's why it is very important that we get a buy-in from the top. We always try to invite the chiefs, the administrative persons, the people that are making the policy and procedures, because we can train the officers, but if their policy and procedure goes against what the training they've been given, then we don't want to put them in a situation that could cause them their career. So that's why we always try to tell them, follow your policies. And we try to ask the agencies, once they buy into the CIT program, make sure you change your policy, adopt your policies to make sure that you cover your officers also. The goal of the CIT program is sworn officers and civilian employees are able to work better with one another and providing better services and assistance for individuals with mental health issues. And that is my spiel for that CIT. Like I said, if anybody have any questions, please feel free to reach out to me. I do work for the Department of Correction. My direct number, it is 769-208-4142. You can reach me at any time, Monday through Friday. But that, I am Christiane Williams, and I thank you all for the opportunity.
Thank you so much for that information. That was wonderful. My name is Kay Denault. I'm with the Mental Health Association of South Mississippi. And I wanted to thank any of our legislators who are on the call. I know I saw Kevin Felsher's name there. Kevin is a representative from the Gulf Coast, and we want to thank him for all of his work, especially introducing the bill for 988 that just passed the Senate. So now we have another speaker named Polly Tribble. Polly is the Executive Director of Disability Rights Mississippi. Polly holds a Master of Science degree in Clinical Psychology from Mississippi State University. After graduation, or after graduate school, she briefly worked as an associate psychologist at Mississippi State Hospital at Whitfield. She has worked at Disability Rights Mississippi since 1990 and has been the director there for almost 8 years. So join me in welcoming Polly Tribble.
Thank you, Kay. I appreciate that. Okay. Disability Rights Mississippi has been in your state for quite some time. I think it's important to note that the mission of our organization, which probably all of you could say this too, is to promote and protect and advocate for the rights of people with disabilities. So we're going to talk a little bit about what we do, and I appreciate the invitation to share with you what Disability Rights Mississippi does, because we know that we're a unique entity. So what we do is Disability Rights is part of a bigger network. So back in the late 1970s and about 1980, there was a horrible media piece about a facility in upstate New York that served people with intellectual and developmental disabilities. So that got a lot of attention. And so our US Congress thought there needs to be a way to protect the rights of people with disabilities, specifically intellectual disabilities. So about that time, the Bill of Rights for people with developmental disability was created. And in that law was a way to protect and advocate for people. So the protection advocacy system was set up. And since that time, there's been other programs that have been added. So while we call our grants, we have 8 different grants, they're really programs that come through the federal government. And all over the country, there are 57 protection and advocacy systems that are designated by the governor. Now, there's only 50 states. Well, there's also one in the District of Columbia. There's a Native American protection and advocacy, and there's some in the US territories. So there's 57 of us all over. Usually they're in the capital city. And your protection and advocacy system is a private nonprofit agency. And each program, each P&A is outlined in laws, and they're really non-competitive continuous funding that come to the organization that's designated by the governor, which yours is Disability Rights Mississippi. We have quite unique access authority to people with disabilities. It would stand to reason that as an agency that is charged and mandated to do this, that we have access to facilities, we have access to records. We have been challenged with that lately. And so we have taken legal means to get that defined so that we can protect the rights of people that we feel need our help. All of these protection and advocacy systems are part of a group known as National Disability Rights Network. And I put the website there for you because they're a big, they go to our national legislators and seek additional funding, but also do a lot of work on how those laws at the national level are shaped for us. So like I said, your protection advocacy in Mississippi is private nonprofit. We have a board of directors that's made up of people all over the state. We also have a PAMI advisory council that stands for Protection and Advocacy for Individuals with Mental Illness Advisory. They just advise us on the work that we do. So we have yearly input from all over the state. We go out and try to get people to help us understand what the issues are and where we need to advocate, in litigation or whatever it might be. So we have annual goal settings, and of course we have to answer to our federal funders about what we've done with the money and what the outcome measures are and just kind of what we're doing. But we take that very seriously, that we get input from the public. And so the work that we do here, we're the only legally based advocacy organization in Mississippi that focuses on disabilities. So the work that we do is definitely Here's some components of that. We do monitoring in facilities, private and public facilities, in prisons, which we'll talk about a little bit more. So that's a big deal for us, is monitoring. And as you can imagine, one of our top priorities is making sure there's no abuse and neglect of people with disabilities. We also do investigations when our monitoring, or we get calls from people about issues that are happening, then we can launch an investigation, and we have people that are trained to do that. And so sometimes those investigations lead into a litigation. We have individual cases that involve employment issues and education, healthcare, transportation. So the way we get cases is people call our office, and they go through an intake process, and then the issue is then presented to our managing attorneys, who decide if we can help in any way, and then it's assigned to a case handler that's usually an advocate, and then we move forward with whatever the issue is. We also have some big systemic issues that we're working on right now, which we're going to talk about too in just a few minutes. The current issues that we're working on that are surrounded by mental health are personal care homes. I think people on this call probably know better than anybody that the housing in our state for people with mental health issues is very sad state. And that involves personal care homes. We have licensed personal care homes, but there's also unlicensed personal care homes that are out there that are in horrible shape and that need to be regulated. So that's one of our focus areas, is just how does that process look? Who's responsible for licensing those, and who needs to hold these personal care home operators accountable for the money that they receive from the person, and how that's spent, and how that person is cared for. We also have a litigation with MDOC on the prison conditions, and how people with mental health issues are treated and cared for in the prisons. So that's a big deal. We are also monitoring the DOJ case and its implications throughout the state. As Wendy said, and I think somebody put in the chat, I encourage you to look at and keep up with the DOJ case. And as collectively, we need to do our part in helping our state do a better job of serving people with mental health issues. We also have a focus on public policy. As you're aware, when you get federal dollars, you can't lobby. So we're real careful that we educate policymakers and legislatures about our work and about what we see as a problem. We do one of our monitoring, some of our monitoring takes us into psychiatric residential treatment facilities. And so we pay close attention, especially to children who are in those places, who are in CPS custody, and how we want to help them live in their least restrictive environment. So that leads us into, we do education related issues for children who have an emotional ruling in the school systems. And that's a big deal for the things that we see. We get calls daily from parents asking for help. Their child might not have an emotional ruling, but they're in the special education. As you can imagine, during this pandemic, we've seen a lot of issues in the school systems, and our children that we work with are really suffering the most, probably from the way that virtual learning's gone and that kind of thing. And again, we do a lot of monitoring of facilities. So I just want to leave you with my name and phone number. We have attorneys at our office, and we had advocates, and we're happy to help however we can. The issues that we take are from people with disabilities, those are our clients. And so the issues that they call with, if we can help them, we certainly want to, or we will refer them to somebody. The issue that we deal with has to be because of their disability. I always give this example. If somebody calls our office and they are using a wheelchair and they're getting a divorce and need an attorney for that, that's not something that we'd help with. But if that same person who uses a wheelchair can't access the courthouse to go file papers or something, that we would help with, because that's an accessibility issue. Again, I appreciate the opportunity to tell you just a little bit about what we do, and we welcome your call and we welcome partnerships with everybody. Thank you, Joy, and NAMI and everybody.
Thank you so much, Polly. That was very helpful to learn more about what's going on in disability rights, Mississippi in general. We really appreciate your work. And I have the pleasure of introducing our final speaker, who's Natalie Moore. Natalie is a certified peer support specialist who works with individuals living with a serious mental illness diagnosis to encourage recovery, resiliency, and community-based living. She works alongside clinicians, community support specialists, and medical staff to solidify the importance of self-directed recovery. After finding ways to combat her mental illness, Natalie believes that her experience is most potent when used to help others regain control of their own once chaotic lives. Natalie has supported the growth of peer support by becoming the first young adult peer support ambassador for the Mississippi Department of Mental Health. Within her current agency, Natalie worked alongside other peers to develop table meetings that focused on the needs of peers and the individuals they serve. Table meetings offer a safe place for peers to come where they did not feel the need to fight for a seat at the table. I'm with you there. That seat at the table should always be there. Natalie has received the Inspiring Hope Award from the Association of Mississippi Peer Support Specialists and is an active member of the AMPS board. Natalie is currently working towards her bachelor's degree in social work from Liberty University. Upon graduating, she plans to implement her personal learned experiences along with the career-focused ideologies in an effort to create a new definition and outlook of true peer support services. So I'm delighted to turn this over to Natalie.
Thank you. Thank you so much. So I'm not sure how I'm going to meet the bar that these wonderful women have set for us, but I'm excited for you guys to hear my story today. So I want to tell you guys about the wildest advice I've ever gotten, in the hopes that one day that you'll think back and remember 3 specific words: 5 more minutes. That's it. That's the advice that saved my life. I bet you're thinking the same thing that I thought. 5 minutes. How in the world will 5 more minutes save a life? Before I answer that question, I want to give credit to the amazing author of this life-saving quote, my dad. 5 more minutes was his answer to the question that I asked: how do I keep going when I want to give up? So buckle up while I tell you the story of how 5 minutes allowed me to be here today and share my story with you. I was first diagnosed with depression at the age of 16. After many trips to urgent cares and ERs, a GI specialist in Jackson explained that my stomach pains were my brain's way of saying something is wrong. I didn't feel depressed, at least not until the very next day, sitting on the bathroom floor beside a positive pregnancy test. Every hope and dream that I had for my life felt like it was slipping away, leaving nothing behind but darkness. I struggled with postpartum depression and felt no connection to the beautiful baby boy that I'd carried for 9 months. But life kept moving. Bullying led me to leave the structure of school and get my GED and begin working. The next 2 years were some of the darkest days of my life. Days spent feeling worthless, like a bad mom, bad daughter, bad sister, and a horrible friend. The negative thoughts I had about myself were validated one day by a stranger's harmless comment of, oh, it must be so hard to be a young single mom. So those thoughts turned into a plan to end my life. I spent time telling family that I loved them and created conflict with friends in the hopes that it would soften the blow of losing me. But I had one last phone call to make to a specific friend who still to this day, if I called, she would not pick up the phone. So in my head, I rehearsed the speech for her voicemail. Hey, I just wanted to call, say I love you and I miss you. Okay, bye. But to my surprise, after 2 rings, the phone picked up. She was at the state fair, and somehow through the noise, chaos, and laughter, she heard it. She heard me. She got quiet for a moment and then said her most famous lines. I'll be at your house in 15 minutes. Beat me there, don't meet me there. So she did. She met me there without judgment, without blame, without shame. She got my parents involved, and they were able to help me find resources for support and treatment that I needed. So that's it. That's the story of how 5 minutes saved my life. I would have missed so many amazing things if I had not taken 5 more minutes to call her. I would have missed seeing Jeremiah play fall ball. I would have missed the experience of buying a house at 25. I would have never met my amazing sweet boy, Jackson, who just turned 1 a few days ago. But enough about me. What would you have missed if you didn't take 5 more minutes? Imagine this. Who would answer the email to confirm your dream job interview if you didn't give life 5 more minutes? What if the love of your life calls to apologize for the angry fight this morning about whose turn it was to take out the trash, but they call 3 minutes too late? What if? What if you bravely chose to stay for 5 more minutes? The possibilities are endless. Resources are available. Crisis stabilization units, community mental health centers, A&D treatment, and Association of Mississippi Peer Support Specialists are all available to provide support. But you can't access those resources if you don't give life 5 more minutes. I hope that when life gets messy, and it absolutely will get messy and continue to get messy, that you can think back today and hear my dad's amazing advice. And even though it's simple, I hope it rings in your ears forever and ever. Just 5 more minutes. Thank y'all.
Thank you, Natalie. That was a very, very inspiring note to go out on. And I would say just 5 more minutes is very inspiring. And what I want to leave y'all with is the idea of just one voice. It may feel like your one voice won't make a difference in our state with policy, with legislation, whatever you want to work on, but it will. You know things that nobody else knows. And I will say, for those of you who are peers or family members of someone with a mental illness, your lived experience makes such a difference. Until all of us are at every, I forgot who talked about the table, but until all of us are at every table, I think it was Natalie, our system isn't going to change and be as responsive as it can be. And we have so many opportunities. And I know Wendy talked about all the good things that are happening with hospital rates going down. And we're just on the brink of being able to see, does that mean that people are really being able to live in the community the way they want to? Those people who aren't in the hospital, are they getting the kind of support they need? And we have such opportunities to all work together on those things and to work with our policymakers on those things. So I appreciate all of y'all being here. I appreciate that on behalf of everyone who is a host today. And we don't want any of y'all to forget that just your one voice can make a tremendous difference. And I think I got asked to do this closing because we do tend to do a fair bit of policy updating at Families as Allies. And so we encourage any of y'all who aren't following that, like through our newsletter or on our website, to go to our website, faams.org. And sign up for our newsletter. But thank you. And thank you to all of our wonderful, wonderful speakers for being here today, and to all of you. Thank y'all so much. And we'll see you next year for Advocacy Day.
And again, thank everyone that participated, and we want you all to know, if you register with Eventbrite, we will be sending this information to the email address that you use to register there, as well as a video recording of this presentation. So you will have access to all of these wonderful organizations that were on today, and you will have contact information for all of them as well. And just check your email for that information. All right, everyone. And I hope that this was everything that you needed to get you going for next year. And hopefully next year we'll see you in person. Everyone have a great day, and thank you for attending.